In this presentation, I'm going to talk about psoriasis. Psoriasis is a non-contagious chronic autoimmune disease. It causes skin inflammation, very itchy silver plaques. Normal skin is divided into three layers from superficial to the deep skin, epidermis, dermis, hypodermis. The hypodermis contains of fat and connective tissue. It anchors skin to underlying tissues. The dermis contains nerves, sweat glands, lymph vessels, blood vessels. It is above hypodermis. Above dermis is epidermis. Itself has multiple layers that developing keratinocytes. Layers of the epidermis, deep to superficial. Stratum basale, stratum spinosum, stratum granulosum, stratum lucidum, stratum corneum. Epidermis has multiple layers that developing keratinocytes that produced and filled with keratin, which is a strong fibrous protein that allows keratinocytes protect themselves and the body. First, stratum basale. The deepest layer of epidermis is the stratum basale. It is a single layer of stem cell. They are cuboidal. They are continually divide producing new keratinocytes. These cells move upward. Second, stratum spinosum. It is the next layer. It has several layers thick. Dendritic cells are in this layer. They are immune cells. The third, stratum granulosum, is the next layer. In this layer of epidermis, keratinocytes begin keratinization and flatten out and lose intracellular structures and die. Next, stratum lucidum. The stratum lucidum is the next layer of epidermis. They are translucent, dead keratinocytes. This layer only found in the thick skin areas such as palms and soles of the hands and feet. The last layer is stratum corneum. The uppermost and thickest layer of epidermis is stratum corneum. New keratinocytes push up old dead cells sloughed off the skin. When a break or cut happens to the skin, microbes can enter to the skin layers and cause inflammation. Then dendritic cells captures bacteria and foreign antigens and break down them into little fragments and present to T cells. Cytotoxic T cells directly kill infected cells, while helper T cells help to overall immune response. T cells release cytokines. Cytokines are cell signaling to run inflammation process. The entire process of inflammation increased proliferation of keratinocytes and also recruits other immune cells such as neutrophils to the site of infection or inflammation. When the immune system completely destroyed bacteria, inflammation resolve and skin back to normal. But in psoriasis, this immunologic response caused excessive inflammatory response. The exact cause of psoriasis is unclear, but there are genetic components and also environmental trigger factors like trauma, previous infections. The excessive inflammatory response in psoriasis does not stop resulting chronic skin damage. Blood vessels dilate in dermis, especially junction of dermis and epidermis, bringing more inflammatory cells to the area, especially neutrophils, into epidermis, resulting excessive proliferation of keratinocytes and thickens all layers of epidermis, particularly stratum corneum and spinosum, except stratum basale that thins out. This excessive proliferation of keratinocytes resulting some defect in maturation of the cells. Keratinocytes produce more keratin than usual. Keratinocytes retain nuclei called parakeratosis. Keratinocytes do not adhere properly to each other, resulting bricks in epidermis and giving scaly appearance of the lesion. What is Auspit sign? Auspit sign is localized spots of bleeding when scales of a lesion picked off. Sign and symptoms of psoriasis, variations of the disease. First, plaque psoriasis. Plaque psoriasis is the most common. It is inflamed, red skin lesion with white silver scales. The plaques are very itchy. They found most in the scalp and extensor regions like knee, lower back, elbows. 2. Gouted psoriasis appears as small round papules that are raised and sometimes scaly on trunk and limbs. It may start after an infection such as strep throat and usually starts in childhood. Inverse psoriasis is a smooth, shiny red lesion. They lack scales, appear within skin folds, under breast, under armpits, groin, skin folds around the genitals and buttocks. Pustular psoriasis, white bumps filled with pus near or inside red skin. They are tender and usually formed on hands and feet. Erythrodermic psoriasis. Erythrodermic psoriasis is a severe variant of psoriasis that characterized by widespread erythema of the skin. It is very rare variant, extremely itchy and painful. Scales fall off in sheets. Psoriatic arthritis associated with skin psoriasis and nail lesions, asymmetric and patchy involvement. Dactylitis and penicillin cup deformity of the IP on X-ray can be seen in less than one-third of patients with psoriasis. Inflammation of the joints. Nail pitting is more common with this kind of psoriasis. Diagnosis of psoriasis. is based on skin lesions and distribution of them. Tissue biopsy confirms the diagnosis. Treatment of psoriasis consists of moisturizers and emollients, clear plaques and reduce itchiness, topical or systemic immune suppressive therapy, UV phototherapy to induce DNA damage in keratinocytes and halt proliferation of keratinocytes, stress control, dietary intervention.